Good afternoon, everyone. Thank you so much for joining us this afternoon. First of all, I do want to thank all of our teachers, school staff, and students for their efforts over this last school year. We know this year has certainly posed challenges, and challenges that we've never faced before. Schools have had to adapt and be flexible as our situation evolves. As this year comes to a close, I want to provide more details on how the remaining few weeks will look. So in consultation with public health and schools, and considering the current health system pressures, schools in Winnipeg, Brandon, and the Garden Valley and Red River school divisions will remain in remote learning until the end of the year. As well, unless directed by public health, schools in remote learning across Manitoba will be able to have students return in limited capacity starting June 14th. This will allow them to meet with teachers and end the year on a positive note. This will mean 5 to 6 students can return at one time per classroom. This limited return will be optional for students and families. While this is not the end of the year we all would have wanted, we still have half of Manitoba schools with students attending regularly. These schools will continue to operate with the additional measures already in place. I do want to give a special message to our graduating students as well. I know this year has been difficult, but there have been many life lessons learned. We know that there are many better times ahead, and the resilience you have shown will be useful in the years ahead. We know your class will go on to do tremendous things despite the challenges we faced this past year. Like last year, I know you can count on your parents, teachers, administrators to find creative ways of marking this occasion. Congratulations to all graduates. Dr. Atwal, I'll turn it over to you.
Good afternoon. I'm Dr. Jazz Atwal, Manitoba's Deputy Chief Provincial Public Health Officer. Throughout the pandemic, schools have done a great job of keeping the virus from spreading in schools. I want to thank the teachers, the bus drivers, the educational assistants, principals, superintendents, anyone affiliated with schools for doing a great job and for leading and for taking care of our kids in school. The data tells us that at this time, 21% of overall COVID-19 cases are in school-aged children. It's important to note these individuals may not have caught the virus at school, though. They may have contracted the virus from a household contact or through community transmission. And they may not have spread it to others in school because they were self-isolating at home. But as of May 30th, there were 335 cases linked to schools within the last 14 days and 170 schools with one or more cases. And most of these schools were already in remote learning. While our case counts are starting to move in the right direction, test positivity rates and the number of cases in hospital and ICU are still too high to broadly reopen schools in certain parts of the province. However, we recognize that there is work that needs to happen that is best done in person. The changes recommended by Public Health will allow schools in remote learning to work with students and assess their progress while ensuring large numbers of people aren't gathering. Schools will be required to follow public health guidance, including determining capacity limits to ensure 2 meters of physical distancing, maintaining cohorts, where possible, limiting the amount of time students spend in the facility, maintaining physical distancing of at least 2 meters, wearing masks except while seated, and limiting gatherings between students. For schools remaining open in other parts of Manitoba, the following public health measures remain in place. Schools with multiple cases outside of the same household cases will be moved proactively to remote learning as per existing guidance in consultation with Public Health. School officials can require students and their staff who are showing symptoms to stay home for 10 days and encourage them to seek testing. Household members without symptoms should also self-isolate or quarantine until the sick individual's test result is received. All extracurricular activities, such as organized sports and off-site activities, are suspended, except for physically distanced walks/runs in the local community. No indoor singing and no indoor use of wind instruments are allowed, and all other public health measures remain in effect. We can now take questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi there. A week ago, the province was looking at a return to the classroom for students, but what has happened in the past week to change your mind?
So, there's still an ongoing strain on the acute care system. Our case numbers are declining. So, we're just averaging under 300 cases on a rolling 7-day average. We peak close to 480 cases on a rolling 7-day average. We still know that we're going to generate more hospitalizations and more ICU admissions over the next week or two. We still need to limit those interactions. Again, the very aspect of being at school is safe. We see very limited transmission in schools. The transmission we see in school-age kids happens typically outside of that school environment. Again, going back to how kids come to school, what they do after school, and what happens in the evening time or with extracurricular events. I think schools have done a great job since the beginning of the pandemic. We've worked with schools, we worked with education to make schools safe. I've got 3 kids in school. I've got 2 10-year-olds and a 13-year-old. They've never been healthier. They haven't been sick at all since the pandemic, and a lot of it is attributed to the mask use, the cohorts, the distancing at school, and the adherence to that on my kids' part, as well as what schools have done. So schools are important. We're in public health. We believe schools are very important. Education is paramount in a child's ability to develop. And we needed some of this to continue on for those kids in remote learning. It was felt that bringing all students back, does increase the risk of transmission. There's a lot more interactions occurring, again, outside of that school setting. So we wanted to allow for assessments to occur, end-of-year assessments, transitioning kids to a new grade. Having those assessments done is important for that as well. So it was felt that it was safe to bring back students in a much more controlled fashion to limit some of those interactions outside of school. So again, our case numbers aren't where they need to be at. Our acute care system numbers are still high, and we still need to worry about that. And we're going to have to continue worrying about it for the next few weeks as well. So we looked at all that information, and it was felt this was the best way to continue forward.
This is the second year school has. This is the second year that schools have ended remotely. How likely is it that next school year students will be able to have the entire year in the classroom?
Yeah, this is what we're striving for from a public health perspective. It's sad to see school end early last year. It's sad to see the point where we're at with schools right now for those kids, for graduates even trying to graduate, the importance of that graduation as well. What we're doing here, the vaccination program, vaccines are going to be able to, provide that glimmer of hope that we're going to get back to some normalcy. So again, vaccine uptake is paramount in our ability to get back to some of those things that we love to do, that we as a society, cherish and want to continue to happen. So next year is still a long ways away. Our vaccine program is continuing to ramp up. We've got over 750,000 Manitobans vaccinated. Those 12 and up can get vaccine as well. We're going to continue to push that. Over the next few months, we're looking at having vaccine available and authorized for those younger than 12 as well. So that'll have an impact on generating cases within society, which again has impacts on the acute care system. So, I think we're going to be in a better spot for sure at the start of the school year next year. And hopefully that will continue on throughout the entire school year. And from a public health perspective, again, practicing the fundamentals and getting that vaccine when your time comes, which is right now, go get that vaccine, will make that happen.
From the Winnipeg Free Press, Maggie.
Dr. Atwal, I have one question for you unrelated to schools on behalf of some of my colleagues. So on what basis did the province determine it was safe to change public health orders to allow immediate families of just players, coaches, and managers who don't have to be vaccinated?
Can you just repeat the question? It just kind of muffled out at the end there, sorry.
Yep. So in the latest public health order, it's been adjusted to allow for immediate family members of Jets players, coaches, and managers who don't have to be vaccinated to attend the games. So on what basis did the province determine it was safe to adjust that order?
Yeah, so in relation to the Jets game and what happened with the Jets game, obviously we wanted to show what a vaccine allows us an opportunity to do. For the healthcare workers, there was 500 healthcare workers roughly that were invited to the game last night. They were all vaccinated with 2 doses. These are essential workers who sacrifice a lot. They represent a small proportion of Manitobans who sacrifice, don't get me wrong, not only on healthcare providers, but there's others, a lot of essential workers out there, hundreds and thousands of essential workers. We're 750,000 people into getting vaccinated. It was an opportunity to show those healthcare workers some appreciation in a very safe way. This was a very organized event. The True North group really did a great job applying the fundamentals, coming up with a plan that would make it very, very safe. These individuals didn't interact with others at the arena either, and it was a very controlled setting. So this kind of shows what we can potentially do once people are vaccinated. This was a small number of individuals that got to partake in this, but we have to take that first step at some point. It was about appreciation. It was about showing the public what we can do once vaccinations increase even greater, once people get 2 doses of vaccine. In relation to the players or the family, these individuals were separated out from anyone else within the arena. They were separated out also from other families, and some of them had vaccination. We didn't know a lot of their vaccination status, but these are family members of players, and they live home together. So it was thought that it would be a safe way to bring people to an arena, to allow families to kind of watch a game. But it was just more about the healthcare workers. It was more about what we can do with vaccine and what potential exists there by having people vaccinated.
Thank you. And Dr. Atwal, did public health do any projections when it comes to looking at how cases could increase if K-12 students were invited back to school before the end of the year in all these regions that were outlined?
Yeah, so projections again are hard, right? It all depends on the adherence. We do, last summertime, kids were brought back in a similar fashion to schools, and we didn't notice any real increase in cases amongst those kids when it occurred last year. This year as well, we're going to bring back these students. It's not going to be large numbers of students at once. This is going to be a targeted approach. Schools and teachers will work with their students to decide, how many students come back, and that number will be capped. There'll be a smaller number there. It wouldn't be an entire classroom. To get those assessments done, looking at perhaps vulnerable students to provide them a little bit more support in the last couple of weeks of school to make sure that they're able to transition to another year as well. So we anticipate, I'm sure, we're going to see some cases potentially generate out of this, but it wouldn't be from the act of being at school again. So this is where that messaging comes into parents. Your kids are going to school, don't carpool. Don't interact with other families before school. After school, make sure you pick up your kid or your kid gets dropped off. They shouldn't be interacting with any other household. Those are the key things here. And remind your kids when they're at school, again, to practice those fundamentals, to distance, to wash their hands regularly, to wear that mask when it's required.
From Global News, Joe.
Hi there, afternoon. I was wondering if the province has any plans at this point, or how the province plans to make sure all these kids get caught up in the fall.
Yeah, thanks for the question. Clearly, we're allowing a couple of weeks here at the end of the school year for teachers to interact with their students and parents. And make sure that we understand where these students are at, so the assessment protocols are certainly in place. We have, again, this year we were providing free education over the course of the summer for high school individuals wishing to pick up some courses. I know we had several hundred students engage in that online last year. We'll be expanding that capacity over the summer for those high school students. I will also say we've set aside $40 million for next fall for allocated to school divisions and independent schools for additional staffing, learning and technology, health and safety. So we recognize there's going to be some catch-up required next fall. So we do have made allowances for that for school divisions to provide that extra learning capacity.
Thank you. And aside from learning, we're hearing from pediatricians who are concerned about the mental health of kids. How big a role does that play in making, in this plan that you've released today? How big a role did mental health play in this?
Sure, I'll address that to start. Clearly we've heard from pediatricians that a number of them would like to see our students in the classroom. Clearly, as a government, we like to see them in the classroom. That's where they learn the best. They also have the opportunity to engage with their peers. And we certainly recognize the importance of that. We are allowing a couple of weeks here at the end of the year for teachers to reach out to parents and students and make contact and potentially bring them into the classroom for that those types of discussions. And I think the parents and teachers know these students the best. They can pick up on some of these issues that students may find themselves in. We have allocated extra resources for mental health to teachers and to students. So those resources are available. So we certainly want to make sure that students and parents and teachers reach out if there's situations that require additional resources. We have that ability through the school system, also through the public health system as well. So we want to make sure that if students do require some of those resources, they are there, and please make sure you reach out.
From the Brandon Sun, Kyle.
Good afternoon. Given how bad the COVID numbers have been for a while, why didn't the province simply just rip off the Band-Aid during the last education announcement from the previous week and announce remote learning until the end of the year? Why leave parents and students in suspense for another week?
Well, I think, we don't really know what the future holds, quite frankly. We're optimistic that the numbers would go down. The pressure might be less on our healthcare system. We could get the 50%, quite frankly, that aren't in the classroom back for those last few weeks of in-room class learning. The reality is different. We're still facing challenges. We think this is an option that we can get the assessments done, provide some closure, prepare for the transition for a lot of these students. Quite frankly, the educators and the teachers know their students the best. They will be reaching out to those parents and those students to engage in those year-end discussions. Not the best situation by far, but we think there's clearly some options here to deal with some of these situations. I will say, we still have half of the schools under normal operation, and we're obviously monitoring those schools as well. But hopefully those schools will end on a positive note as well.
All right, thank you. And how much flexibility will these K-12 schools in places like Brandon and Winnipeg have when it comes to their high school graduation ceremonies? Will there be kind of any government oversight for this process at all?
Yeah, we've provided the schools some guidance around graduation exercises. Clearly, we don't know what the public health orders will look like in detail at this point in time. So we're asking schools to be mindful of what the public health orders are at the time of graduation. We expect there won't be large gatherings allowed, so please adhere to that. We went through this last year, so I think we're going to be in a similar situation to last year. I know that teachers, parents, administration were quite innovative in finding ways to mark these occasions, and I think they will do the same this year.
Thank you.
From CJOB, Skylar.
Hi, Dr. Atwal and Minister Cullen. Thanks for your time. Minister Cullen, some teachers are wondering how this new in-person meeting allowance will balance with, the requirement to still cater to some kids of critical care workers in class already?
Right, so we are accommodating students of critical care workers. I think that amounts to about 20% actually are in the classroom as we speak. So we are going to allow people, students over and above that 20%, groups of up 5 or 6 in that range, to come into the schools. We will leave the details up to the educators. They are the experts. They know their students the best. We're allowing them to work with the parents, and they can make that determination who they think should be in the classroom, how often they should be in the classroom, and then be mindful again of the fundamentals in terms of public safety.
Thank you for that. And Minister Cullen, I know the province has, designated a fair amount of funding to ensure schools are going to be safe moving forward. But can you give a guarantee today to those disappointed kids, disappointed parents, disappointed teachers that when kids return to the class, it will be safe? Are there going to be, upgrades to things like ventilation in some of these older facilities going on through the summer when, there's obviously a ton of empty space in the school to do that?
Yeah, our goal all along is to have kids in school as long as it was safe to do so. That's why we've been working closely with our school community. We've been working very closely with our public health officials on this front. And as Dr. Atwal pointed out, hopefully by September we'll have even a higher population vaccinated, and including students. I think we're all optimistic we can have a regular return in September. As you pointed out, though, we recognize there will be some catch-up work to do. We've allocated close to $60 million for the next school year to accommodate extra expenses related to COVID. We will go forward, but again, we will make sure that public safety is front and center.
From the Winnipeg Sun, Josh.
Good afternoon. Minister Cullen, you just kind of talked about the 20% of students that are still attending because they're parents are frontline workers and the like. Considering the vaccinations that have taken place, was there any consideration to allowing those who had already been vaccinated under restricted levels to be able to return to class as well? If this is about getting kids back in classes before the end of the school, if we already have a bit of a blended learning situation in Winnipeg and Brandon and a couple other school districts, was there any consideration to allowing those kids to have been vaccinated, so 12 and up, to be able to return in some capacity as opposed to just switching it off and right back to remote learning for the rest of the year?
Just on the vaccine side here, so you got to remember, we've opened up that window for those 12 and up to get the vaccine. Once you get the vaccine in your arm, it does take 2 weeks to develop that immunity. So only a small number of those, between 12 and 18, let's say, have been vaccinated so far. When we're looking at risk here, when we're looking at allowing kids back, for these assessments, for in-person support, clinical support, assessments, transition planning. It's key here for those teachers to work with those kids, provide that one-on-one or group session if need be. A lot of students have sacrificed. They've suffered through a lot of this as well. We still see community transmission. We're still generating, 300 cases on average per day. We still have that strain on the acute care system. So we still want to limit those interactions. It's too early to allow a lot more interactions to occur. So we need to be aware of that. We're at the beginning of June here. And I think we have to see how the next few weeks go, but we're still going to be busy. We have 40 people out of province in ICU right now. That's a huge number, right? That's unprecedented. And that's all because of the cases that we generated as Manitobans, right? And those numbers have peaked. Those numbers are coming down. They need to drive down a lot further for us to be able to allow more interactions to occur. So I think the plan here with allowing, students to come back either individually or in small groups to work with teachers to transition out of one year to get into the next year to do those assessments, that's important. And public health I stress this a lot here. We love school. School is very important for kids, for development, for mental health, for social development, for education. So we don't take a decision like this lightly. When we put kids on remote learning, we had to really think long and hard about it. But we felt it was the best thing to do to cut out those community transmission events, to break those chains, which it's doing. So by letting kids come back on the 14th in smaller groups in high-risk areas, which is where this remote learning is occurring, is the safest way to get those assessments done, to allow those kids to transition. So we didn't want to open it up universally because that would cause just too much risk.
Okay. And Dr. Atwal, what kind of a trajectory do you anticipate for hospitalizations and ICU patients by the time we reach the next date for the reconsideration of health orders? Are you still expecting those hospitalizations and to continue to climb, or should we expect by the time we see new health orders be seeing those level off?
Yeah, so the health orders expire on the 12th. I think when you look at our total hospitalizations, there might be plateauing right now. The ICU numbers are maybe plateauing, but if they go up by 10%, that wouldn't surprise me. The hospitalization number, if it goes up by 10% to where it's at right now, that wouldn't surprise me. We generated a lot of cases. The way we generated cases, that exponential rise we had, it was a 70% increase in average number of cases over 7 days. That wasn't seen anywhere else in Canada. And we had great restrictions on Manitobans during that time. And then the way we sort of plateaued, we didn't have a nice little gradual hump coming down in relation to cases. We sort of plateaued and bounced up and down a little bit. So what does that mean? That could mean there is a lot of non-adherence, that we were a little bit, in quotation marks, blind to the true number of cases. So, over the next 1 to 2 weeks, I still see potentially numbers increasing. I'm hoping they're plateauing, but it wouldn't surprise me to see another 10 or 15% increase. That's not out of the question. So we'll just have to see and wait to see what happens with those numbers.
From CBC Manitoba, Ian.
Good afternoon. Minister Cullen, what is the expectation in this month of remote learning in terms of learning of new material? Is there going to be a deadline like there was last year on when teachers will stop teaching new material?
Yeah, I'll leave the operational side to the experts. Clearly, teachers and principals are the experts on that front. I know it's been a challenging year all around. Obviously, students respond differently to different learning methods. Ideally, we would love to have them in the classroom through this, but this just wasn't the case. So we'll leave the learning component up to the respective teachers. I'm hoping this will provide at least some closure to the end of the year. Obviously, assessments are required to be done by the teachers, and then we're looking at transitioning as well into the next school year. So a lot of work remains for sure, but we'll leave the operational aspects to it, the details, up to the experts in the classroom.
And Dr. Atwal, do you have a sense on vaccination rates among high school students and the staff as well?
I don't have numbers. I know there's been a lot of bookings and vaccine already provided to high school students and those 12 and up. I just don't have any specific numbers. The vaccine task force would have numbers available. And again, week by week, those numbers change, day by day, they change as well. So that question might be best posed to the vaccine task force next week.
From the Canadian Press, Steve.
Oh, hi, Mr. Cullen. Are you looking at changing the grade structure or any changes to the upper grades in high school to make up for some of the lost learning in the coming school year or after?
Yeah, in terms of structure, I don't foresee any changes in structure, but clearly we've identified there's going to be some learning catch-up work to do. That's why we've allocated close to $60 million, and a good portion of that for the for learning recovery, we'll call it. So again, we will leave the operational component to the experts in the classrooms to decide how best to make sure our students do get caught up. As I said, we've also allocated money for online learning for high school students throughout the summer. That will be free of charge to students who want to take that on. We know we had several hundred engage in that last year. I expect we'll probably have more engage in that over the course of the summer. And then as the fall gets on, we're preparing for the fall and for more of that learning recovery time, and we'll leave that those aspects to the in-room classroom experts.
And Dr. Atwal, you mentioned that ICU cases may go up by as much as 10%, and I know it's hard to predict precisely because it depends on the rate of recovery and how many people are entering and exiting the ICU system. But can the system we have now handle what's coming? Is there a concern that even with the recent approval by Alberta to accept up to 10 patients, are we in danger of exceeding the capacity of what other provinces can offer?
Yeah, we have 127 people in ICU in Manitoba, of which 68 have COVID. We have 40 more that are out of province. When you look at our total number of Manitobans in ICU, that's 167 right now. That's a big number. We got 40 people out of province. Ontario's helped, Saskatchewan's helped as well, and Alberta as well. The other provinces are really helping Manitobans out. I think they see the disproportionate impacts of ICU stays in Manitoba compared to some of the data that's available there as well. Arrangements have been made. We're in discussions with them all the time. Shared Health is in discussions with them all the time. I don't think that we are at risk of exceeding any set number. That could be a great question to pose to Shared Health because they have specific dealings with the other provinces. But from my understanding, it's unfortunate we are sending people out of province, first of all, but there is that support from our neighbours to be able to help Manitoba out in this situation related to our ICUs.
Our final reporter this afternoon from CTV Winnipeg, Jeff.
Hi, Minister Cullen. I'm just wondering, these assessment groups, I take it they'll be similar to what happened last year. Is the expectation that the students would only go for, say, an hour or two, or would they be going all day?
Yeah, we'll leave the individual on the operational side up to the respective teachers. The teachers know their students the best. So we're asking them to reach out to parents, make those necessary arrangements. I can see a variety of things happening as we go forward. Some students may need more face-to-face time than others. So again, we'll leave the operational side to the experts.
Okay, and Dr. Atwal, you answered an earlier question on allowing the family members of players and coaches into the game last night, saying that, the province doesn't know the vaccine history of the people who were in there, and presumably some of them wouldn't. We're talking about kids, maybe people only getting their first shot. Why, and I know safety precautions were taken, you said, but why let anybody in there who's not directly connected to working there or in the or with the game if they don't have both vaccinations?
Yeah, each one of these individuals, family households, were treated as a separate group, right? They didn't interact with other families. A lot of these players have kids. They weren't eligible for vaccine as well. So this was a way to, again, bring some people to be able to watch a game, to see their parents play. For Manitoba. Last night's hockey was more about again what we can do. When we are vaccinated. We brought in hundreds of people who were fully vaccinated. They were all separated. And they didn't interact with others. The family groups and the general population groups related to healthcare workers didn't interact at all, and even the family groups were never interacted with each other as well. So last night was about, again, what can we do with vaccinations? What's possible, why it's important to get the vaccination, what it might allow allow us to do going forward as well. And it's about, appreciating a workforce, again, a small representation of all the essential workers in Manitoba, and allowing them a time off for 3 hours, right? So again, this is about what we can do with vaccine. This is about what we want to be able to do with vaccine. And this is about how we take that first step toward being able to do those things.
Thanks, everyone. This concludes our media briefing.